and welcome back. Today's video is on lip reduction surgery. So in case you have larger lips, in case you are uncomfortable with the size of your lips, if you have overhanging lips, or in case you got your lip augmented and they look much bigger than what you wanted them to be, we have something called as lip reduction surgery. It is a minor procedure in which we can reduce the size of the lips to a natural and to your desired shape and size, so that the lips look much more harmonious and natural and as per your face. So if I have to summarize, this procedure usually takes around half an hour to up to 1 hour. We can do it for both upper lip as well as for the lower lip. The scar is not visible since it is given on the mucosa. The scars heal really well, and once the stitches heal, the scar is almost completely invisible. It is on the inside, so not visible to anybody. It can be done under local anesthesia. If someone has a fear of anesthesia, then you need a general anesthesia. Otherwise, with nerve blocks, with small injections given on the cheeks, entire upper lip can be blocked, and 2 small injections given on the chin, the lower lip can be blocked, and you can have the whole procedure in which you will be completely conscious, and we can remove all the extra amount of lips. It's a daycare procedure, and thus you can get discharged from the hospital within 1 to 2 hours from your surgery, once you are fit, once you are completely normal. If I have to talk about the pros of this surgery, the benefits or the pros of these surgeries are that it is a very simple and a minor procedure which is permanent and can cure your issue of unnaturally large lips within half an hour to 1 hour. It is almost scarless because the scars, even if they are inside your mouth and thus not visible to anybody. And third, that the procedure is done under local anesthesia and you need not stay in the hospital. You can walk back home after 1 hour of the procedure. If I have to enumerate the cons, the problems or the cons of the surgery would be that one, it is a surgical procedure and we need to cut your lips to make it shorter, make it smaller. It is irreversible, so if we reduce the size, you'll need something else to make it bigger. And there is a lot of swelling post the surgery. You will need at least 1 week to up to 10 days of leave from your work. But it's good that you have to wear mask these days, and if you are thinking of a lip reduction surgery, the COVID times are a boon in this way that you have to wear a mask, and thus even if you develop swelling on your face, it won't be visible. So an ideal candidate is one who has larger lip as compared to their facial features, and they have realistic expectations, who understand that they will suffer swelling for up to a week's time and they can take out 1 week off. Ideally, you should be a non-smoker so that the stitch line heals. You should be otherwise healthy and not suffering from any major illness like diabetes or hypertension. So if I talk about the surgery, first of all, I would like to discuss what is to be done before the surgery. So before the surgery, we have to assess your face. We have to assess your lip. What is the proportion of the upper lip with the lower lip? And then I'll need to discuss with you what you have in mind and what you think is a beautiful lip. A very simple procedure that I like to do with my patients is that I ask them to keep their lips normally and mark a line, and then I tell them to purse their lips like this in a way as to how much reduction they would want, and then mark it again so that I know exactly how much reduction is what they are looking for. And then the same amount of lip we can remove from inside the mouth, and thus the scar won't be visible outside as what we have marked. Before the surgery, we would want to see if you are healthy enough for the surgery or not. So we would like to have your investigations, your blood workup like a normal hemogram and other investigations. In case you are on any medications, you need to tell me so that we can assess your medication and we can stop the medications which are not necessary during the preoperative or the perioperative period, and you can continue the medicines which are necessary. So if I talk about the surgery per se, on the day of the surgery, you need not be empty stomach, as this procedure is usually undertaken in local anesthesia with mild sedation. If it is done under general anesthesia or it is combined with other surgeries, in that case you have to be nil by mouth for at least 6 hours, and we take your pictures in the way that you want your lips to appear. We do a marking, in which I have a technique in which I mark the lips when you have normally placed it, and then I ask you to purse your lips in a way in the size that you would want, and then that amount of that width of the lip we measure it, and then we remove that amount of lip from the inside of the lip so that there is no scar that is visible, and then the marked area of the lip is removed, and it is done with a special instrument so that there is minimal bleeding. And once we remove all the lip that we want to, we take adequate precautions to stop all the bleeding, and then stitches are given, which are self-dissolving stitches. So post-operative period of lip reduction is what that bothers a lot of patients, and you should be aware of what is coming after the surgery so that you can prepare adequately. Since the lips are numb, you are not allowed to drink anything which is extremely hot or even warm. I would advise you to take cold food for initial 1 or 2 days till the total sensation is back. You do not accidentally burn your lips because they are absolutely numb for initial 4 to 5 hours. Then again, there is a lot of swelling that is going to come, and it will increase up to 2 days, and then it starts going down and can take up to 7 to 10 days for the swelling to completely disappear. And again, to prevent any sort of infection, you will be advised to take antibiotics. For pain, you will be given painkillers and antacids. Also, you will be taking mouth gargles to prevent any sort of contamination in the lips and to prevent any local infections. So this is all about lip reduction. Anybody would want to know, I have tried my best to explain the whole procedure, the care you should take before, after and during, and what to expect of the surgery, what not to expect of the surgery, how to plan for it. And we constantly put out material regarding plastic surgery and aesthetic surgical procedures on our channel. If in case you are interested and if you like our content, please do like, share and subscribe, and comment below on what videos you would want us to make. Thank you.